Assalamualaikum warahmatullahi wabarakatuh. My name is Nur and Shafika binti Muhammad Zaki. In this video, I will talk about understanding viral disease, causes, symptoms, and control measures of human immunodeficiency virus, or well known as HIV. So sit back, stay focused, and let's dive into it together. First and foremost, let's talk about the overview of this virus. HIV is a virus that attacks the body's immune system, specifically targeting white blood cells with a protein on the surface called CD4 receptor. This cell is called CD4 T cells or known as helper T cells. If left untreated, HIV gradually destroys so many CD4 T cells until the body can no longer defend itself against infections, and it can lead to the most advanced stage of HIV infection, which is acquired immunodeficiency syndrome or known as AIDS. There are two types of HIV, which are HIV-1 and HIV-2. HIV-1 is the most common type worldwide and is responsible for the majority of infections, while HIV-2 is less common and primarily concentrated in West Africa. This means that if you encounter HIV anywhere else in the world, it is almost certainly HIV-1. HIV-1 is transmitted more easily, which is a key reason for its rapid global spread rather than HIV-2. HIV-1 is more virulent than HIV-2, meaning it is more aggressive and causes disease progression more quickly. Individuals infected with HIV-1 tend to have a higher viral load, which is the amount of virus present in the person's blood, while HIV-2 has lower viral load that relates to its reduced transmission risk and slower disease progression. For the treatment, HIV-1 is highly effective against antiretroviral therapy. Meanwhile, some of these drugs are less effective or even completely ineffective against HIV-2. Finally, these viruses have distinct origins. Both are zoonotics, but HIV-1 originated from chimpanzees, while HIV-2 originated from sooty mangabe monkey in West Africa. So, how is HIV being transmitted? HIV spreads when certain body fluids from an infected person enter the bloodstream of another individual. These fluids include blood, semen, vaginal fluids, rectal fluids, and breast milk. The most common ways the virus is transmitted are through unprotected sexual contact, sharing contaminated needles or syringe, and from mother to child during pregnancy, childbirth, or breastfeeding. Transmission through blood transfusion is extremely rare today because modern healthcare systems screen donated blood very carefully. Next, symptoms and clinical features of HIV depend on the stage of infection. The first stage is acute stage, where shortly after a person is infected, usually 2 to 4 weeks after exposure, they may experience flu-like symptoms such as fever, sore throat, swollen lymph nodes, rash, and fatigue. The second stage is the chronic stage, where the infection often becomes silent for years and the person may not show any symptoms while the virus continues damaging the immune system. As the immune system becomes weaker over time, the person may start to develop the third stage, which is AIDS. It is the most serious stage of HIV infection, where the infected person is having frequent infections, weight loss, persistent fevers, and chronic diarrhea. The immune system is badly damaged and the body becomes vulnerable to opportunistic infections and cancers such as tuberculosis, severe pneumonia, and certain types of lymphomas. Anyone of any age, race, or sex can be infected with HIV, but certain behaviors and circumstances can significantly increase an individual's risk. Engaging in unprotected anal or vaginal sex is the most common risk factor globally. Having another sexually transmitted infection such as syphilis or herpes can also increase the risk because they can cause sores that provide an entry point for HIV. Sharing contaminated needles, syringe, or other injection equipment is also a very efficient way for HIV to spread. In addition, a baby can become infected if they are born to an HIV-positive mother who does not receive proper medical prevention during pregnancy, delivery, or breastfeeding. Hence, understanding these risks help us create better prevention strategies to protect individuals and communities from HIV transmission. Finally, and most importantly, let's talk about how we can control and prevent HIV. Although there is no cure for HIV, the disease can be controlled very effectively by practicing safe sex using condoms, using sterile equipment and avoiding needle sharing for people who inject drugs, and undergoing regular HIV testing because the only way to know HIV status is to get tested. For people living with HIV, antiretroviral therapy is the cornerstone of control. This medication suppresses virus to undetectable levels, allowing people to live healthy lives and making it impossible to transmit the virus to their sexual partners. This medication also reduces the chance of passing HIV from infected pregnant mothers to their babies. There are also medications such as pre-exposure prophylaxis, which is a daily pill that can reduce the risk of getting HIV from sex by over 99%. For those who may have been exposed, post-exposure prophylaxis is an emergency medicine that must be started within 72 hours of exposure. In conclusion, HIV is a serious viral infection, but with proper knowledge, prevention, and early treatment, its impact can be greatly reduced. Awareness and education are essential to protect individuals, families, and communities. I hope you guys learned something from this video. Thank you for listening.